Hello, my name's John. I was stuck in the hospital for the past 2 days, and I thought with all my time I was sitting there waiting for my test results, I decided to put together this little PowerPoint presentation trying to tell people on how the healthcare business works. Um, I've been in the benefits field for some time and work with insurance carriers and all that jazz, and it's kind of confusing. So I just kind of want to give a nice vanilla approach to everybody on how the system really works because I know it's a hot topic today. So, um, basically, let's start at the point of service. You have yourself, you, and drops in the doctor. You go see the doc. Yo, doc, what's up? There's something wrong with me. The doctor, of course, gives you the service. Obviously, medically speaking, they check you over, see what's wrong with you. You, in turn, then pay the doctor. Depending on your plan or your insurance, you usually pay them, or typically would pay them a copay, which is a flat dollar amount, like $20 per office visit, maybe $40 for a specialist, or a co-insurance, which is the percent of the actual visit. Now, that is where most people understand it, is that exchange right there between you and the doctor. And also, people understand this exchange of how they pay for healthcare. They, their point of payment for the employee, enter company. So you are an employee of a company. Ta-da. That company obtains insurance rates from an insurance company. I'll explain that here in a little bit. But here's typically what they're at, where they're at. HMO is about $13,000 per year. A PPO is about $10,000, and a high deductible plan is about $7,000 for that's the annual cost for a single coverage. These are real numbers. This is about right. This is what people pay for trying to get an individual plan. They, of course, then the company share this cost with the employees. Employers are really nice. They pick up about 80% of the share, and they stick you with about 20%. Now, if you're a governmental employee, you get stuck with only 10%. There's go ahead and research that on the Department of Labor Research website. It shows that government employees only pay 10% of their share, which is a nice package, and obviously a point of disdain for me. But anyways, on average, about 20% you'll pick up. So that's about, let's say you have a single PPO plan, $2,100 for you a year, which is about 175 pre-tax dollars that you pay. That's a nice deal. That's not too bad. And you could see the company pays up the other $700 per month. That's the amount people never realize that's being paid. There's a lot of money on the table that's floating around with benefits. So there you have it, at least in the cost of coverage. Now let's continue on to the point of payment for the company. You're pretty much out of the picture now. As far as you know, you pay your $20 office visit and you get a certain amount taken out of your paycheck per week, per month, whatever. That's all you know. Here's where I come in my experience with working with companies and insurance carriers. The company has two options. They can be either fully insured or they could be self-insured. Notice a little horns coming out of the company. Just kidding. Um, it's just depending on their choice depends on their ability to spread the cost of the claims risk across a pool of lives. Obviously, if you're a smaller company, you'll have to do the self-insured route. And why? Because the self-insured pools, or the pool is provided by the carrier. So enter insurance carrier. The insurance carrier says, hey, look, here's a pool of people. You are, say, the pool of people for mom and pop shops all across America. I'm going to provide that to you, and here's some plans to choose out of it. Bow. All right, you're self-insured. You can pick off-the-shelf plans. The bad part is it's very limited on what you can choose. The good part is it's a fixed cost per employee per month. So once one that's been negotiated, you pay that for the year. That's it. That's what a company has to pay. The other option they have is a fully insured. This fully insured, their pool is provided by the company claims experience. So this happens for larger companies like your large manufacturers, your large retailers, your just government. Just very large companies can do this because they're able to spread the risk of claims across their entire population within their organization. So their pool comes from the company itself. It's nice because they have some flexibility to determine plan design, but it is a variable cost per month because what they're doing is they're actually paying the actual cost of all the claims. They're actually paying it $1 for all the claims. But it comes a little bit more difficult to determine the cost for the employees. That's why they have to hire an actuary. They help determine these costs on what to pass along to employees. But there's also one more insurance that happens when they are fully insured. Enter stop loss, another insurance product. So, like I said, companies under a fully insured plan has to pay all the claims. Stop loss will help them pay, say for example, they've got a couple preemie cases. They're paying millions of dollars in claims this year. Well, their stop loss will kick in after $2 million, let's say. So the plan or the company pays $2 million. Stop loss will start to pay for the next $2 million, or hopefully that's it. But stop loss only picks up the next $2 million, and after that, the company has to pick up the rest. But they, of course, pay the insurance carriers as well. So as you can see, it's kind of confusing. A lot of arrows going here, there, and everywhere. So one of the things a company does do is enter Mr. or Mrs. Broker. Just like selling a house, it's difficult. There's a lot of paperwork, a lot of inspections that need to be done. So you hire a broker, and in return the broker gets kind of a kickback from either the buyer or the seller. Same thing with the insurance world. Companies work with brokers. They assist companies with negotiations with insurance carriers to help set everything up. They're familiar with the business. They know what's going on. They work with the insurance carriers and the companies. And typically the brokers are paid by fees from the carriers. Da-dow. There's that line. There was a giant consulting firm that got hit with this a couple years ago because before the fees didn't have to be disclosed. Now they do. So as a company, we know what the broker's getting paid by the insurance carriers. That is transparent. So that's not too bad, but sometimes you wish they weren't paying them at all and you got it all for free, but it doesn't work that way. Next up, so we got a plan document. So we figured out how this is all paid for in some way, shape, or form, fully insured or self-insured, and how claims are paid. So whether a company determines to go fully insured or self-insured, enter the plan document. This is the legal document that outlines everything from your co-pays, co-insurance, your deductibles, your pre-existing conditions, coordination of benefits, definition of independence, etc., etc., etc. So when you go to the doctor's office and the doctor says, look, you're not qualified, your insurance won't cover that, that's because the insurance carrier is looking back to the plan document. Again, the legal document telling the insurance company what's eligible for payment, what's not eligible for payment, who's eligible for payment. That plan document is the living, breathing insurance and benefit plan.